With more people than ever living with HIV over the age of 50, considering the future of HIV care has never been more important. We met the Gilead Sciences team and people living with HIV to find out why innovation in HIV care is needed for older people to ensure they live long, healthy and independent lives.
I believe that I was going to die. It was shocking. Now, 18 years later, I'm still alive. I'm growing well. I'm doing all the right things.
JIDE was in his 30s when he was diagnosed with HIV. He's living life to the full, but there's concern and uncertainty around growing old.
Aging with HIV is a whole different concept in itself. The challenges of getting older with HIV most certainly includes isolation, because you want to be sure that there are people who care for you and understand your needs. There are people who care for you if you have to go into a care home for the elderly. I don't think I know of any specific services for people growing older with HIV. And I think that is something that will be on my mind, very soon, and should be on the mind of service providers as well.
It's something that's very much on the mind of the team at Gilead Sciences. Gilead has been working in HIV for the past 3 decades. And as the first generation of people living with HIV gets older, they're committed to supporting HIV-positive patients as they face new challenges of ageing.
People living with HIV are subject to the same conditions associating with ageing as the general population. So these so-called comorbidities, but often they have more of them than the general population, and they can tend to affect people living with HIV at an earlier age. So even though treatments have been really highly successful and enabling a generation of individuals living with HIV to head into older age, HIV itself is not sorted, because we need to think about the complexities of managing those comorbidities and making sure that we've got joined up care so that people ageing with HIV can age well and healthily and have zero difference to the general population in terms of their long-term health outcomes and quality of life.
There are 105,000 people living with HIV in the UK. Of these, around 4 in 10 are aged 50 or over. Globally, it's estimated that 70% of people living with HIV will be over 50 years old by 2030.
I think we really need to be cognizant within HIV services to not kind of blow that trumpet too much, that isn't it great that you're going to live well into your 80s, because actually a lot of these people haven't worked for maybe 20 years because they were told there was no need to. They don't have savings because they were told to spend them, and they don't necessarily have a social network around them either. Within that, we're also seeing those people developing conditions associated with older age, such as cardiovascular disease, bone problems, kidney problems, certain cancers.
Gilead's programmes such as HIV Age Positively campaign involves collaborating with innovators, voluntary organisations and future thinkers to design a better present and future for people ageing with HIV. And when it comes to the future, Vanessa is one of many young people facing the challenges of ageing with HIV. Her outlook is positive and she's preparing for older age now, but she's well aware that there are obstacles to overcome. How do you feel about growing older with HIV?
Growing with HIV and what the future shaped for me. Because I'm someone that, once I did come to terms with it, I was like, I want this job, I want to do this and that. There are no limitations in the future for us people with HIV. The only limitation is yourself, to be honest, and with that being said, it's how you come to terms with every aspect of your life and how you deal with every hurdle that comes your way.
Joined up care into older age, bringing service providers together, is vital to help those who faced and continue to face the challenges of HIV.
It is important to look out for each other, whatever the circumstances we find ourselves.